The Green Paper set out our vision for the future, which was to build a new national care service, which would fundamentally be fair, simple and affordable for all adults in England. Obviously, that's a very high-level vision statement, so I just want to kind of touch a bit more about what that vision actually means in reality. Again, I'm sure a lot of you have seen this diagram before with the hexagons and the circles, but I'll just talk through it. Rights and entitlements will be at the heart of the National Care Service, but to make those rights and entitlements feel real, we obviously want to have a better quality and more integrated system so people genuinely experience a better service because of those rights and entitlements. And throughout all of this system, we recognise that families and communities continue to play a key role in care and support, in the care and support system. So if I go around from the top, around probably in a clockwise direction, I think. So prevention services, the red block at the top. This is the first of the 6 pillars that we think everybody should be able to expect in a national care service in England. By prevention services, we mean the right support to help people stay independent and well for as long as possible and to stop their care and support needs getting worse. So it's kind of prevention, early intervention, some of the services like reablement, and also some of the projects that have been really successful in the Partnership for Older People pilots, where we published the evidence on those last week, where again, by working with older people, we're really beginning to transform their experiences and their lives and really seeing some benefits for individuals. So that's prevention services. A lot of the prevention services will require the National Care Service working in partnership with other parts of the public sector, be that the NHS or other bits of local government such as housing, leisure, adult learning, etc. So it's a really important partnership role in delivering some of these rights and entitlements. The next hexagon along is national assessment. And what we want to achieve in the National Care Service is that wherever you live in England, you would have the right to have your care needs assessed in the same way. And you'll therefore have the right to have the same proportion of your care and support costs wherever you live, and I'll touch on funding in a moment. And importantly, you'll be able to take your needs assessment with you wherever you go in England. So your needs assessment will be portable, and that will obviously allow individuals to have greater certainty if they're planning that they want to move to be nearer to family who might have moved away. They don't have to have, I think the problem at the moment is that they don't know what they'd be entitled to if they move to an area. So being able to carry your needs assessment with you would be a really big step forward. People could obviously, if the move changed their needs, they could obviously ask to be reassessed. But if it wouldn't change your needs, your assessment should be able to go with you. The next hexagon along is a joined-up service. It's kind of a thing that's very easy to say and quite difficult to deliver, as Nick was pointing out. So all the services that you will need will work together smoothly, particularly when your needs are assessed. That's something that government and the public service have been saying for an awful long time, and I think people's individual experiences will say at times it works and at other times it really doesn't. So this is something where we need to really drive forward to make sure that we do see a step change in that. In particular, what we want to see there on assessment is that you would only need to have one assessment of your needs to gain access to a whole range of care and support services, whereas at the moment people have to have multiple assessments for the different parts of the care and support system. Moving down to the bottom, kind of at 6 o'clock, the information and advice. What we want to achieve here is that when you need care and support, or if you're preparing for it, or you want to understand about it, you will find it easy to get information about who can help you, what care you can expect, and how quickly you can get it. And that's likely to need to be a mixture of national and local information. So national information about how the process works, what you're entitled to, but local information about the services which are provided. The next hexagon along, personalised care and support. Again, this is something that putting people first has really been driving recently, and lots of our other strategies are trying to progress personalisation. And what we mean by personalisation, I'm sure is familiar to a lot of you, is that your care and support will be designed and delivered around your individual needs, as opposed to being designed around the needs or wants of a particular institution or public service organisation. So as part of your care and support plan, you'll have a much greater choice over how and where you receive support, and obviously with the possibility of controlling your own budget where that's appropriate. So really trying to drive forward the successful concept of personal budgets, which a lot of people are experiencing and finding very beneficial to enabling them to have personalised and flexible services. The final pillar or entitlement within the National Care Service is that you'd be entitled to a fair funding, where here you'd be clear that the money in the system will be spent wisely, and you'll know that everyone who qualifies for care and support from the state will get some help meeting the costs, and the proportion of that help I'll discuss in a moment when we talk about fair funding in a bit more detail. That vision is, some elements of that is really building on putting people first, and this is about really trying to drive forward and beyond putting people first to genuinely put some elements of a national consistency in the system and to ensure that the entitlements are real and genuine for individuals. So this isn't a change, it's not a direction change from the reform programme and putting people first, it's a change of pace and ambition. The three things that we think we need, which go around the outside, that we think we need to happen to the system to mean that the 6 pillars or the 6 entitlements within the National Care Service become a reality, are more joined up working between health, housing and social care, and between care and the benefits services. A wider range of care and support services, so we actually have services out there in the market that meet people's needs. That's particularly important the more personal budgets there are, so actually people want to be sure if they've got their own budget that there are the services out there in the market that meet their needs. And finally, we want better quality and more innovative services based on the evidence about what works best. And I think we'd all would probably agree that in social care we haven't really had a very strong evidence base about what good care is. We're increasingly getting that with evidence from Putting People First and from the Partnership for Older Peoples and some of the dementia elements of the dementia strategy, which were about building the evidence base. But that's something we need to do much more on, and we also then, when we know what works, we really need to be able to drive the system to implement that, so we don't have islands, we have consistency of that best practice.